for joining us today for our annual Medicare seminar with Justin Lubenow, who is the Executive Vice President at Senior Advisors, LLC, based in New Jersey. Senior Advisors is a family-owned and operated general agency for Medicare supplements, Part D and Medicare Advantage plans. Justin will present for approximately 1 hour and 15 minutes. After that time, we will have Q&A, not live. It will be live, and we will not be using the chat function. You can ask questions to Justin at the end of his presentation. You may also contact Justin for any questions that you may have after the seminar. This seminar and others are offered quarterly by the Foundation for Morristown Medical Center and the Brookfield Legacy Society, who are individuals who have included the hospital in their estate plans as a benefit to the donors of our hospital. We also often open registration up more widely to include members of our community as we are today. We hope you will join us for future seminars and look forward to sharing our schedule for the 2021 season very soon. Before I turn it over to Justin, I wanted to share a bit of news about our hospital, Morristown Medical Center. As you might have heard, Morristown Medical Center was, for the third year in a row, recently ranked the #1 hospital in New Jersey, according to News and World Report's 2020 Best Hospitals. In addition, we achieved 3 national rankings in orthopedics, gynecology, and cardiology, and we are the only acute care hospital in New Jersey to be nationally ranked. We could not have accomplished this without the support of our donors, especially in the face of the COVID-19 pandemic. Atlantic Health System and Morristown Medical Center have been at the forefront at looking at ways to support our communities throughout the pandemic. Recently, Atlantic Health System created the COVID-19 Research Center, which provides a central point for patients to seek care, working with healthcare providers to design an individualized, tailored plan for recovery and guide them to the medical specialists who help them carry it out. So I hope you will all look at this research center. We can send you information. It's also on our website. With your help, we can continue to serve our communities and be ready to deliver safe and extraordinary care during these still difficult times. Don't delay critical care, and remember to see your physician for regular checkups and treatment. And now I would like to introduce you to Justin Lubenow. Justin is an experienced concierge advisor in the Medicare industry focused on education and keeping his clients informed of changes. In 2020, Justin hosted a Medicare panel in Washington, D.C. with former Congresswoman Allison Schwartz, President and CEO of the Better Medicare Alliance. He was also selected as the Vice Chair of the Medicare Advisory Board of the National Association of Health Underwriters and is an active lobbyist for protecting Medicare benefits. Welcome, Justin. We are really looking forward to your presentation. Thank you.
Great. Thank you, Cindy. Thank you for having me. We've done these presentations the last several years at Morristown Medical Center, and they've been very well received. Obviously, it was a different time where we could do them in person, but we're excited today to do this workshop, and obviously in a virtual format. It actually allows us to kind of reach more people. And as we go throughout the presentation, Cindy mentioned that you can actually ask your questions. There's a Q&A function in the Zoom. Feel free to type your questions there. Periodically, I'll take a checkpoint throughout, and we'll just review to see if there's any questions as we go through the presentation. Before we jump into the actual content, I'm going to do just a very brief background on who we are and kind of what we do at Senior Advisors. Essentially, we're a Medicare general agency really focused on helping people with their Medicare planning. We're family owned and operated. It's my father's business. He's been in the insurance industry about 30 years. We have a separate business and small group benefits. And as people were aging out of those groups about 10 to 12 years ago, he never really had a solution for Medicare. One of his close friends got him educated on Medicare, and he started Senior Advisors, which has become one of the largest general agencies in the country for Medicare plans. We have over 25,000 Medicare clients across the country. Large majority are in the Northeast, New Jersey, Pennsylvania, New York. But we are licensed in pretty much most of the country as far as the states go. We've got 2 different offices. My office is in Cranford, not too far from Morristown. And then we have another office in Morristown, New Jersey, not Morristown, but Morristown down in South Jersey. These are all the states we're licensed in, pretty much the whole East Coast and the Southern and West Coast as well. So pretty much, you know, majority of the country. So we really focus, like I said, on the education piece. You know, we're going to go through that today and give you a background on how different parts of Medicare work and go through all that in today's presentation. But then we can help people with their different options and plans. We work with all the A-rated insurance companies. We're not captive to a particular insurance company, but when it comes time, we help people with their enrollment into their different plans as well. So again, just very brief background. I just wanted to kind of level set kind of who we are and what we do. And now we're going to jump into the actual presentation today around Medicare. And it's broken into 4 sections. So the first section is really kind of a Medicare 101, the different parts of Medicare. How much do you pay for Medicare? If you're in a higher income bracket, how much do you have to pay for that Medicare to the government? We're going to talk about when you should be signing up for Medicare in section 1 as well. What are the differences between Medicare Advantage plans and Medicare supplements? And so that's really all in section 1. In section 2, we're going to talk about Part D of Medicare, which is the prescription drug plans. And I'm actually going to try and do a live demo if the website is working well for us, the government website for picking the best drug plan. I'm going to show you how we do that and how anyone can do that on their own if they'd like to look for the best drug plan for their situation. Section 3, we're going to touch on some things that have changed in 2020 with Medicare. Some of these things were kind of pre-COVID, if you will, kind of beginning of the year announcements, and then some things that have changed just recently since because of COVID, some things that Medicare changed. And then section 4, we just recap the top 5 mistakes that people make on Medicare. So those are going to be highlighted in sections 1 and 2. And then at the end, we just recap those 5 mistakes. So hopefully you can avoid those mistakes. All right, so what are those different parts of Medicare? Very high level first. Part A is the hospital benefit. So basically Part A is going to cover if you're an inpatient in the hospital, or if you get transferred from the hospital into a skilled nursing facility, that would also be covered under Part A of Medicare. Part B of Medicare is basically everything outside of the hospital, your doctor's visits, your testing, x-rays, outpatient surgery, expensive things like chemotherapy, kidney dialysis, or infusion therapy. All that falls under Part B of Medicare. Part C of Medicare, and this is a bit of a misnomer, but it's another way for you to take your Medicare benefits. And it's also called a Medicare Advantage plan. This is a completely different way where you're basically signing up for a private insurance plan that's being fully administered by an insurance company, United Healthcare, Aetna, Cigna. I mean, there's all different options out there. But if you sign up for that Medicare Advantage plan, you're no longer on original Medicare Part A and B. It's all bundled together into that Medicare Advantage plan, the hospital, the doctors, and the drug plan all bundled in together. So we're going to talk today, not in specific Medicare Advantage plans, but we're going to explain the differences high level between a Medicare Advantage plan versus original Medicare. Part D of Medicare is the prescription drug coverage that's also run by private insurance companies, but it's heavily integrated with Medicare, systems and Medicare rules that they have to follow for those Part D drug plans. So we're going to explain those. And again, we're going to try and do a live demo of the Medicare Plan Finder site so you can see how we pick the most cost-effective Part D drug plan. Now, how much do you pay in premium for each of these parts of Medicare? Well, Part A, most people don't pay any additional premium. As long as you've worked 40 quarters and contributed to Social Security and Medicare tax, or your spouse has worked those 40 quarters, there's no additional premium for Part A. If you don't meet that criteria, Part A is actually very expensive. It's over $450 per month for that Part A hospital insurance. The Part B medical insurance, the base amount this year is $144.60 per month. Okay, so that's for income, and we're going to review the income adjustments on the next slide, but for single income below $87,000 and for joint income below $174,000, they just pay the base Part B premium, which is $144.60 a month. If your income is above that amount, you have to pay additional amounts to the government, which we're going to discuss. The Part C premiums, these are going to vary just depending on the plan. If you enroll in a Medicare Advantage plan, just know that they can go all the way down to $0 a month, or they can go up to $200 a month for those Medicare Advantage plans. If you enroll in the Medicare Advantage plan, you still have to pay the Part B premium to the government in addition to the Medicare Advantage premium. So, and then the Part D drug premium, this is also income adjusted. Most people, if you're in that base income bracket, you're just going to pay that plan premium for the drug plan, which ranges anywhere from next year. The lowest premium is about $7 a month for that drug plan, but some of them go up over $100 a month for the Part D prescription drug coverage. Right. Now, what are those income adjustments? So if you're in a higher income bracket and you sign up for that Medicare Part B, this table shows you how much you have to pay the government for those Part B premium. The base income, again, if you're 87,000 and below as a single, or 174 as a joint income, you pay the 144.60. If you're in the second income bracket, you would pay 202 a month, and so on and so forth. And it goes all the way up. The top income bracket this year is above 500,000 for single, or 750 for joint income, and they're paying almost $500 a month. That's to the government for the Part B premium. That's before you add on a supplement and a drug plan. That's just, just to start and be on Part B of Medicare. So this can be a shock to some people. They're in a higher income bracket. They think they're going to go on Medicare. Everything's going to be very inexpensive. And if you're in a higher income bracket, it can be, a little bit expensive. So there's also an income adjustment on Part D, as in drugs. And the way this works for the drug plans is the same income brackets. If you're in that base income bracket, you're just paying the plan premium for the drug coverage. If you're in one of these higher income brackets, you have to pay the IRMA, the income adjustment amount, plus the plan premium for the higher income amounts. So you'll see $1,220 a month plus the plan premium, or $3,150 a month, or $50.70 a month, all the way up to $76 in addition to the premium for that drug plan. All right. So these are the income adjustments on Part D, as in drug. Now, if you add up both of those together, the Part B premium plus the IRMA's income-related monthly adjustment amounts, this table shows you what those total amounts would be for the higher income bracket. So again, this is before you add on a supplement and a drug plan. This is just what you're paying the government for being in those higher income brackets. All right. Now, the other thing that's important here is the timing of the income adjustment, or the income that's being used to determine the income adjustment. So for example, if you're signing up for the first time for, let's say, January 1st, 2021. And by the way, we don't have visibility to 2021 premiums yet. Those don't come out until kind of November, end of November timeframe. But for example purposes, if you're signing up for January 1st, 2021, the government's going to use your 2019 income to determine your 2021 premiums. And the reason for that is they don't know your 2020 income yet. They have to use the last tax record that they processed, which at the end of this year is your 2019 tax return. So they're using your 2019 tax return to determine your 2021 premium. Now, that's obviously a flawed system, because there's life events that could have occurred since 2019, such as a work reduction or work stoppage, retirement. And you can actually appeal these IRMAs when you get the letter that explains the IRMA. If your projected income for that year, so if my 2021 projected income is going to be less than 174,000, even if my 2019 income was in a higher income bracket, I can appeal, and the government will have these IRMAs reduced or removed and put me back into the correct income bracket based upon my projected income. And the only way they know that is by that appeal process. All right. So you have to appeal within the 60-day window if you're going to be in a lower income bracket for that following year. All right. All right. I'm just going to check in to see if there's any questions. Again, use the Q&A function in the Zoom as we go through this. Feel free to ask your questions there. Okay, so when should you be signing up for Medicare? All right, there's this 7-month initial enrollment period, also called IEP, that's built around your 65th birthday. All right, and the way this works you're technically eligible for Medicare the first of the month you turn 65. All right. However, you can enroll as early as 3 months before the month you turn 65. So the 7-month window is 3 months before your birthday, the month of your birthday, and 3 months after your birthday. That's your 7-month initial enrollment period. And so in the example, if your birthday is September 10th, your eligibility or effective date will be September 1st. You can get the coverage the first of the month you turn 65, but you can enroll as early as 3 months before that, as early as June 1st, to get that September 1st effective date. All right. If you don't have other creditable coverage from like a group employer plan, which we're going to talk about in a minute, if you don't have that coverage, this is the time you have to enroll in your Medicare to avoid any penalties or delays in your Medicare start date. All right. Again, we're going to talk about if you're still working past 65 in the next slide, next couple slides. But if you don't have other credible coverage from an employer plan, this is the time you have to enroll. If you miss the window, there's a 10% penalty for every year you don't have the Part B when you're supposed to have it. So if you waited 2 years, you pay the 20% penalty on the Part B premiums, not just for 1 month or 1 year. You pay that penalty the rest of your life if you miss that window. All right, so this is the #1 biggest mistake we see people make on Medicare, is not enrolling in that Part B when they're supposed to. And we see it from a frequency perspective, but also from an impact perspective, kind of the #1 mistake we see people make. All right. There are a few questions that have come in, so I'm just going to see what's come up here. If you so back to the appeal process, if you retire during the year, is it the appeal process that you use to adjust your premiums? That's Marsha's question. Yes, Marsha. So if even if you're signing up for Medicare in the middle of the year and you get that IRMA letter that explains your premiums, if your projected income for that full calendar year is going to be in a lower income bracket, you have a 60-day window to appeal when you get that first IRMA letter. And then you'll get another letter at the end of the year, which explains your premiums for the following year. And again, you get a 60-day window to appeal, because it takes 2 years for this to get caught up. So that's how that would work.
I should have given it to her before. Thank you.
And then the other question, will we get copies of the presentation? We can work through that. Yes, we can send that out. If 2 people are on Medicare, are the rates quoted per person? So we went through the Part B premiums, you pay the government, and the income adjustments. Those are individual. So each individual pays those Part B premiums or the IRMA income adjustments to the government. That was Kathy's question. Lauren asked, can you appeal the 10% penalty for not signing up on time? There is an appeal process for the Part B penalty if you didn't sign up when you were supposed to. However, you have to have a pretty good reason for them to approve the appeal on the penalty as far as why you missed the window. So, all right, so those are the questions so far. We're going to move on. So we were going through the initial enrollment period, and basically these 3 months after your 65th birthday technically are part of that initial enrollment period, meaning there's no penalties if you enroll in those 3 months, that 3-month window. However, there is a delay in the effective date if you enroll in those 3 months after age 65. So I want you to be careful with this. If you're planning to retire or sign up for Medicare right around your birthday for 65, you want to do this before you turn 65 rather than those 3 months after. And the reason is for this, if you enroll at 3 months before you turn 65, the coverage is going to start the first of the month you turn 65. If you enroll in that month you turn 65, the coverage will start the first of the next month, which makes sense. Where it stops making sense is if you enroll in those 3 months after your birthday. The first month after your birthday, your coverage won't be effective until 2 months later. If you enroll 2 months after your birthday, your coverage won't be effective for 3 months after that. And same thing if you enroll 3 months after your birthday, your coverage won't be effective for 3 months after that date. So the point is, you really want to avoid these 3 months after your birthday when you're enrolling, because you could have a delay in your effective date for the Medicare coverage. All right. All right, so we got some questions about working past the age of 65, which we're going to get to in a minute, but I think we're going to address those on this slide. So a lot of people are working past the age of 65, or your spouse is still working and you're covered on your spouse's plan. So do you have to sign up for Medicare if you're covered on that group health plan? Well, there's something called the Medicare secondary payer rules. These are federal rules defined by the government, which determine who pays first, meaning which insurance is going to pay your claims first if you're Medicare eligible. And the first row of this table, if you're working or covered on a group health plan for a company that has less than 20 employees, Medicare is going to be the primary payer. So what does that mean? That means, yes, you absolutely need to sign up for Medicare if you're in that first situation. If you're turning 65, you're Medicare eligible, and you're covered on a group plan with less than 20 employees, whether it's your plan or your spouse's plan. If the company has less than 20 employees, Medicare is primary, which means you have to have your Part A and B of Medicare. And then it's up to you at that point whether you want to stay on the group plan as your secondary or go get your own, supplement and drug plan. In most cases, in that first row, you'd be more cost effective to get your, supplement and drug plan rather than staying on that group health plan, since Medicare is going to be primary. If you don't sign up for Medicare in that first situation and you have a major claim against your group health insurance, the carrier doesn't have to pay 80% of your claim because Medicare is primary. All right, so that's very important. If you're in that situation and you're Medicare eligible, yes, you absolutely need Part A and B of Medicare. The second situation, if the company has more than 20 or more employees, the group health plan will be primary. So that means if you're turning 65 or over 65 and you're still working, or your spouse is still working, as long as the company has more than 20 employees that's covering you on the group health plan, you can stay on that group health plan as long as you continue to work or your spouse continues to work. You don't have to sign up for anything with Medicare if you don't want to. It's up to you in that second situation. All right. Now, you're permitted to sign up if you prefer to go with Medicare in that second situation. If it's going to cost you less and get you better coverage, that's completely up to you to do that, comparison. That's something we can help with as well. If you want to look at the comparison, should I stay on the group plan or go get Medicare? That's something that's up to the individual in that second situation. The next few rows here next couple of rows are similar rules, but it's for a different way to qualify for Medicare. So if you're on Social Security disability for 24 months, you could be 35 years old, whatever, you qualify for Medicare after 24 months. So if you're qualified for Medicare due to disability, these Medicare secondary payer rules are a little bit different. It's looking at a company with less than 100 employees where Medicare is primary, and more than 100 employees where the group health plan would be primary. All right. If you're on an employee retirement plan and you're entitled to Medicare, Medicare is primary. So if you happen to be a teacher in New Jersey for 25 years, you have that retiree health plan, you turn 65, you have to have your Part A and B of Medicare, and then the retiree plan would be a secondary or would coordinate with, that Medicare. Now, the last row of this table is one of the more confusing parts. It has to do with COBRA health insurance. And COBRA, basically, if you work for a company that's more than 20 employees and you're 66, 67, 70, whatever, and now you decide you're going to retire, you get laid off, by federal law, the company has to send you this letter, this COBRA letter, offering you to keep the same group health insurance for up to 18 months. Now, you pay the full premium with the COBRA, sometimes with the 2% admin fee. But basically, it's presented as the same health plan you had, right? So the difference is, and it's not always clearly communicated, as long as you're working at that company and it's more than 20 employees, that group health plan is your primary payer. Once you leave active employment and you're Medicare eligible, Medicare becomes primary coverage for you. So that COBRA coverage will be secondary to Medicare. So you have to sign up for Medicare A and B if you're going to be going on that COBRA coverage after age 65. This is not always clearly communicated to people, and people get into situations where they miss this enrollment window and there's penalties and delays with their Medicare coverage if they're enrolled in COBRA and they don't enroll in that Medicare A and B. All right. I'm going to take a quick checkpoint again. There's some questions that have come in. Paula asks, penalties only happen if you're not working after 65. If you're still working, that wouldn't happen. So again, as long as you're working and you're covered on that group health plan and the company's more than 20 employees, you don't have to sign up at 65. You can stay on that group plan and sign up when you leave active employment. So that was Paula's question. Leslie's asking back to the income figures. Are the figures for the income that we looked at earlier gross income? It's technically, it's called modified adjusted gross income, or MAGI, which for a lot of people is going to be similar or the same as their AGI, adjusted gross income. However, there are certain deductions that get added back in. So it is possible that your modified adjusted gross income is greater than your adjusted gross income. All right, that was Leslie's question. Richard asks, do you get a penalty for delaying Part B if you worked and had coverage in a plan with over 100 participants and retire after age 65? The answer is no. We just went through that. As long as you enroll after age 65 and you've had that group coverage, we're going to explain how you're going to do that and to avoid those penalties and delays. There's a couple of forms you're going to need, Richard, and we'll walk through those shortly. Kathy's asked, if you're retiring January 1st, older than 67 and have been covered by a group employment plan, when do we enroll to avoid the penalty? Okay, so basically we're going to go through this as well, but generally we like to start the process about 6 weeks before you're going to be leaving the group health insurance, and that gives us plenty of time to get everything set up for the first of the year, so there's no penalties or delays, no gap in coverage. Technically, if we could submit the forms on December 31st and still get a January 1st effective date. However, it takes several weeks to get the ID cards and the approvals, so we don't recommend that. But technically, as long as you submit before the effective date, you should be able to get that coverage. So that's, Kathy, that was your question. All right, so let's keep rolling here. So now if you decided it's kind of time to enroll in Medicare, there's a few different scenarios for how you can enroll in Medicare. The first one is if you're turning 65 and you're already enrolled in Social Security benefits, you're going to be automatically enrolled in your Medicare A and B. So the government will just mail you your red, white, and blue Medicare card about 3 months before your birthday. That's if you're already getting a Social Security check. And it's up to you in that first scenario if you want to keep the Part B, or if you don't want to keep the Part B, you just call up the government and say, look, I've got coverage through a group plan. I don't need the Part B right now. And they'll send you a new card with just the Part A on it. All right. So that's the first scenario. The second scenario, if you're turning 65 and you're not enrolled in Social Security benefits yet, and you want to enroll in Medicare, you can do it directly on the Social Security website. Here is the link right here. It takes about 5 or 10 minutes. That's really the easiest way to do it. If you want to enroll, prior to age 65, you can technically call in, do it over the phone with Social Security, but it's easier, straight from the website, if you're comfortable with that. If you're enrolling after age 65, so a lot of the questions have been around people working past the age of 65. How do you enroll to avoid those penalties and delays? So there's 2 forms you're going to need if you're in that situation, if you're enrolling after age 65. The first form is an enrollment in Part B form, which you're going to fill out and sign, or your spouse. If your spouse is signing up, you both need this Part B form if you're both past the age of 65. The second form, which is more important, is the employment information form. And we call this also the proof of coverage form. And the second form gets filled out by the employer that's covering the group health plan for you. And that form shows that you've been covered on the group health plan since you were 65. And the employer basically signs off on that form. And that's how you avoid any penalties or delays, is by submitting those 2 forms. You could fax those into Social Security. You can mail them in. And they actually just introduced a web portal, if you prefer, for people enrolling after age 65. This was created during COVID. It was in May that they created this because the Social Security offices were shut down and people couldn't go there physically to enroll after age 65. So they created this web portal where you can submit those 2 forms I just showed you, just do it directly online. And you basically upload a proof of your group health insurance, which is like a picture of your health insurance ID card when you submit the form online. And that avoids the signature required from the employer and those other forms that I just mentioned. If you do it online, you don't have to submit those other 2 forms. So there's a couple of different options there. Again, you could do the paper forms and fax or mail them in, or now they have this new web portal if you're enrolling after age 65, where you could submit those forms directly online. All right. I'm just going to check in on the questions again. We got some more that came in. Paula asked, what if our employee retires from our company and goes on to working full-time somewhere else? Do they still have to sign up for Medicare? No. So if the person wants to sign up for the health plan for the new company they go to, As long as it has more than 20 employees, they can stay off of Medicare and just roll into that other group health plan. So that shouldn't be an issue. Linda, how do you appeal an IRMA adjustment? So there's a form called SSA 44, which is a Social Security form that you would submit to start the appeal process on those IRMA adjustments. Again, you have to do that within 60 days of receiving the IRMA letter where they explain your IRMA amounts. Gordon asks, how long does a person covered under a group plan have to register once he leaves the group plan? Good question. So you technically get an 8-month special enrollment period when you leave a group plan after age 65 to sign up for Medicare without any penalties or delays. We never recommend waiting 8 months because you're not covered for that 8-month period. But technically you have up to 8 months special enrollment after your coverage ends to sign up for that Part B without any penalties or delays. We recommend starting again before you're going to be leaving the group plan, so there's no gap in coverage. So that, if you leave 12/31, your Medicare starts on 1/1. All right, Lauren asks, can you legally have both group coverage through an employer and Medicare? Yes, you can have both group coverage and Medicare. Depending on the situation, we looked at those secondary payer rules. The group health plan would pay primary if the company has more than 20 employees, or if the company's less than 20 employees, Medicare pays primary, and then the group plan. All right, Elizabeth asks, if disabled and covered by parents' retiree group health plan, is Medicare primary? Yes, if you're Medicare eligible because of the disability, then Medicare would be primary, and then the retiree plan would be secondary for Elizabeth. Anonymous attendee, are the penalties one-time penalties, or do you pay additional 10% the rest of your life? The Part B penalty we talked about earlier, if you miss that enrollment window, applies the rest of your life if you have that Part B penalty. All right, so we're caught up on the questions. We're going to keep rolling here. Okay, so now you decided that you've enrolled in Medicare. The time is right. You're on Medicare. You've got a decision to make, and the decision is whether you stay with original Medicare, which is the left side of this diagram, or do you go with a Medicare Advantage plan, which is the right side of this diagram. All right. If you go with the left side, you're still getting the Medicare, original Medicare from the government. That's the hospital Part A and Part B. Generally, we recommend a Medicare supplement, also called a Medigap plan, to fill the 20% gap roughly that Part A and B don't pay. So if you go with this left path, a lot of people go with the supplement and a Part D drug plan. All right. So this is one option or one path you can take once you sign up for Medicare. The other option or the other path is called the Medicare Advantage plan, also called Part C of Medicare. And that's where the insurance company bundles everything in together into that fully privatized plan, fully administered again by Aetna or United Healthcare or Blue Cross Blue Shield or whichever insurance company you sign up for. You're fully administered now by that particular insurance company. You can't do both of these paths at the same time. You can only be an original Medicare or a Medicare Advantage plan. All right. Now, what are the differences between these two paths? So at a high level, and again, we're not going to get into specific Advantage plans. Each carrier has, 3, 4 or more options in each county. So you might have 40 to 50 different Advantage plans to choose from, just depending on where you live. But we're going to explain the differences so you understand kind of high level between original Medicare and those Advantage plans, how they work. So the first difference is the relationship to Medicare Part A and B. With a supplement, it just supplements Medicare. So you're still covered on that red, white, and blue Part A and B Medicare card. And then if you have a supplement, it's just supplementing Medicare. So it's filling those gaps. It's another ID card you'd have that pays that other 20%, for example, of your medical expenses. However, a Medicare Advantage plan replaces your Part A and B of Medicare. So if you sign up for that Medicare Advantage plan, you're no longer using that red, white, and blue Medicare card. Now you're using that, that individual carrier that you signed up for is sending you an ID card, and that's what you're using when you go to the doctors and hospitals and so forth. There's no private network required if you go with original Medicare with a Medicare supplement. So you can go to any doctor or hospital in the country that accepts Medicare, which is 99% of hospitals and 90% of doctors. You don't need referrals to see a specialist if you have that original Medicare with the supplement. With the Advantage plans, most of these are HMO type plans where you have a private network of doctors and hospitals that you have to go to with those Advantage plans. Some of them now offer a PPO benefit, which is an out-of-network benefit. So even if the provider isn't participating, there's a potential you could still see them. However, the provider still has to accept the payment terms in those PPO plans. Some of the plans of the Advantage plans do require referrals, although a lot of them are getting away from that with the Medicare Advantage plans. The Part D drug coverage, that is not included with the Medicare Supplement or Medigap plan. With a Medicare Advantage plan, that drug coverage is bundled in there, all in that one Medicare Advantage plan. Monthly premiums are going to vary for supplements as well as Advantage plans, but the supplements are generally going to be a higher premium. That's the amount you pay monthly for the insurance than a Medicare Advantage plan. Some of these Advantage plans go all the way down to $0 a month in premium. All right, so now how that works, they're not giving away free insurance. Essentially, when you sign up for a Medicare Advantage plan, you're no longer on Medicare. So basically, the government pays the insurance company, it's about $1,000 a month for you to be on that Advantage plan. Since you're no longer on Medicare, the government's not administering your benefits. Your claims are all being handled by that insurance company. So the government is paying the insurance company for you to be on that Advantage plan. All right, so that's how those zero premium plans work with the Advantage plans. The out-of-pocket cost, so that's the amount you pay if you get sick, if you go to the hospital, if you have expensive things like chemotherapy or kidney dialysis. With a Medicare supplement, there's minimal to zero out-of-pocket cost. With the Medicare Advantage plans, this year it's up to $6,700 per year and out-of-pocket cost. Next year, that's going up to $7,550 maximum out-of-pocket on those Advantage plans. That's defined by the government, that increase for next year. Guaranteed renewable for life. Medicare supplement, once you get in, the coverage is federally regulated and it's guaranteed renewable for life. So as long as you pay the premium, you can keep that same coverage the rest of your life with a Medicare supplement. With the Medicare Advantage plan, those plans do change every year. So if you're in an Advantage plan in September, you get a thick book called an ANOC, or Annual Notice of Change, and that highlights all the differences that are happening with your Advantage plan for the following year. That's if the plan is available. Sometimes these plans do get canceled for the following year as well. All right, so this is just a high-level difference so you understand, between a Medicare supplement or Medigap plan and Medicare Advantage plan, some of those high-level differences. This is the third biggest mistake we see people make on Medicare, is not understanding those differences between Medicare supplement and Medicare Advantage plans. Two very different types of health insurance. All right. I'm just going to check in. We got a question here. Sue Lee, are you locked in forever? If you choose one or the other, can you change plans? So we're going to talk about this a little bit. With when you first go on Medicare Part B, as in boy, so that could be 65, it could be 70. Whenever you first sign up for Medicare Part B, you get a 6-month period where there's no medical questions asked for a Medicare supplement. So during that 6-month period, if you want a Medicare supplement, the insurance company has to give it to you. You can get any supplement you want with no medical questions. After that 6-month period, if you want to get into a Medicare supplement, there's medical underwriting. So each carrier has about 10 to 12 different knockout questions. And if any one of those is a yes, you can't even submit an application for that supplement. So technically you can switch from year to year, but there is potentially underwriting for the Medicare supplements. There's no underwriting for the Medicare Advantage plans. So those you could technically get into each year with no underwriting. Anonymous attendee, if you have a supplement and you don't want to change it, do you need to do anything during this enrollment period? The answer is no. Medicare supplement is guaranteed for life. So that'll just keep on keeping on if you have a Medicare supplement. All right, so let's go through how these supplements work, okay? And if I use the term supplement or Medigap, those are synonymous. But the most popular supplements, if you go with a supplement, are Plan F, Plan G, and Plan N. And those letters are designated by the government. So the government, again, designs the Medicare supplement coverage, and the insurance companies just administer the plan. So it's the exact same coverage, regardless of which insurance company you get it from. When you get a Medicare supplement, it's a widget. It's defined by the government, and they all work exactly the same. If you have a Plan F from United Healthcare, from Aetna, from Cigna, or Mutual of Omaha, it's the exact same coverage, regardless of the carrier. So I'm going to walk you through how these supplements work so you understand. If you have a Plan F with Part A of Medicare, this is the hospital benefit. This table shows you everything that's covered under Part A, how much Medicare pays, how much the Plan F pays, and most importantly, what do you pay for each of these services? So if you go to the hospital, and let's just say you have original Medicare with no supplement, the first 60 days in the hospital, you would have a deductible of $1,408. So if you don't have a supplement, that's what you'd be responsible for the first 60 days. If you have an extended hospital stay, more than 60 days, day 61 through day 90, you would pay $352 per day as a copay. And if you have a stay more than 90 days, you pay $704 per day in the hospital. If you have that Plan F supplement, it'll pay that deductible of $1,400, $1,408. It'll pay the copay of $352 per day for day 61 through day 90. It'll pay the copay of $704 per day for day 91 plus. So if you go to the hospital and you have a Plan F supplement, what do you pay? Nothing. You're fully covered. No out-of-pocket cost to you for that, Part A. You get transferred from the hospital into a skilled nursing facility. And to be clear, this is not a long-term care or assisted living. This is like a rehab facility. If you have a stroke or a knee replacement, hip replacement, you're in the hospital for a few days, you get transferred into the skilled nursing facility. The first 20 days are fully covered by Medicare. Day 21 through 100, Medicare has a copay of $176 per day. So if you just had Medicare without a supplement, you pay that $176 per day. If you have the Plan F supplement, it pays that copay for you. So you can basically get up to 100 days in skilled nursing with no cost to you. All right. So that's basically how Plan F works with Part A. There's essentially no out-of-pocket cost to you. Now, Plan F, we're still looking at the same plan, but now it's with Part B of Medicare and how that coordinates. Part B, again, is everything outside of the hospital, your doctors, your testing, specialists, x-rays, CAT scans, outpatient surgery, durable medical equipment, expensive things like chemotherapy, kidney dialysis, all that's under Part B of Medicare. And the way Part B works, there's a deductible. This year it's $198. So Medicare doesn't pay that deductible. If you have a Plan F, it'll pay that deductible for you. And then Medicare pays 80%, and that Plan F would pay the other 20%. So what would you pay? Nothing. No copay, no co-insurance. You're basically 100% covered medically between Medicare and the Plan F supplement if you have a Plan F. You get, there's also something called Part B excess charges, where doctors can charge up to 15% above the Medicare approved amounts for their services. It's not very common that they do that, but if they do charge the excess charge, there's only two supplements that would cover that, Plan F and Plan G. So if you have a Plan F or Plan G, which we're going to talk about next, you wouldn't have to worry about that Part B excess charge. The plan would pay that for you. All right. So Plan F is kind of the easiest to understand because there's no out-of-pocket cost medically. However, it's also the most expensive because it's fully covering all those gaps. The next plan that has become popular, Plan F used to be the most popular plan, but it's gotten very expensive. And also the government introduced a rule that Plan F essentially can no longer be offered to someone who is newly eligible for Medicare as of January 1st, 2020. So if you just turned 65 or you're going to be turning 65, that Plan F is no longer an option for you. So there's a plan called Plan G, which has been around for a number of years, and that's becoming the more popular plan because Plan G is exactly the same as Plan F. So Plan F, again, pretty much fills all the gaps, no out-of-pocket costs. Plan G is identical. I'm not going to go through all those tables again. You're still fully covered in the hospital. It still pays the 20% that Medicare doesn't pay under Part B. The only difference is Plan G does not cover the Part B deductible, which this year is $198. So if you have a Plan G supplement, you would get a bill from the doctor after the first or second doctor's appointment that totals to $198. And then after that, Medicare pays the 80% and the Plan G pays the other 20%. There's no co-pays, there's no co-insurance. It's exactly the same as that Plan F, except for that deductible for Part B. Why it's become more popular is when you compare the premiums between the F and the G, we have people that are 70 or 75 years old. They could save $600-700 a year going from an F to a G, and the only difference in coverage is that Part B deductible. We've saved couples over $2,000 a year, switching from an F to a G with another carrier. And again, the only difference is that deductible of $200. All right. We've got some questions. I want to get to one more plan before we get to the questions. So F is, again, pretty much full coverage. G, you just have to pay that little Part B deductible, and then you're 100% covered. Plan N is the next step down, and it's going to be lower premium than Plan G. And the difference is you're still fully covered in the hospital under Part A, but under Part B, you have that deductible of $198, just like the G. And then you have copays up to $20 for your doctors and specialists, $50 for the emergency room. And Plan N also does not cover those Part B excess charges. So if the doctor charges the Part B excess charge and you have the Plan N, you would be responsible for that Part B excess charge. So again, it's a little bit of a lower premium option than the Plan G. Still pretty good coverage, but there's more variable costs with the copays and the potential for the excess charge. All right. Now there's another 7 or 8 different, Medicare supplement letter designated plans defined by the government, but 95% of people, if you're going with a supplement, go with one of those F, G, or N Medicare supplements, because those are generally the best value that are out there. All right, we've got some questions here. Elizabeth, if the provider does not accept Medicare, can a Medicare Advantage plan reimburse for service? Generally, the answer would be no. Those Medicare Advantage plans that have PPO or out-of-network benefits, generally the provider has to be a Medicare participating provider to use the out-of-network benefit. So generally the answer would be no. Man asked a question, is one subject to underwriting and switching Plan D providers? I think you're asking about Part D, which is the prescription plans, which we're going to get into. There's no underwriting on Part D prescription plans, so no, there's no underwriting there. Michelle, since all the Medigap plans are the same with all carriers, are the premiums also the same, or do you need to shop? The premiums are not the same. So these are private insurance companies that are selling the supplements. So they factor in, it's a business. So they factor in their claims cost, their marketing, their business cost, their profit margin. So that's all factored in, and you will see variable costs in the monthly premiums across different carriers. And that's something we can help with, looking at all the different options that are out there to find the most cost-effective supplement. Lauren asks, can you sign up for a supplement plan after you've already been using Part B for a few months? Are there any penalties? Yeah, so yeah, you can sign up to 6 months after you started Part B with no medical questions. You can still get a supplement plan. If you're past 6 months, that's where you'd have to go in through that medical underwriting to get into a Medicare supplement. There's no penalties per se, but you may not get approved if it's past 6 months. Sue Lee, what's the excess charges? Once again, doctors on Medicare have an option to elect over a period of time to charge all their patients a higher rate than Medicare. They can charge up to 15% in these Part B excess charges. It's not very common, but if they do charge that excess charge, the Plan F and G would pay for that, whereas the Plan N would not pay for that excess charge. A couple other questions about how to find the pricing for F versus G, or where do we look for that? So that's something we can certainly help with, look at all the different options that are out there. And I was going to get to this at the end, but there's no fee to work with us. So if you want us to take a look for you, you're going to pay the same premium for that supplement, whether you work with us or you go directly to the insurance companies for those Plan F or Plan G, but we can certainly help you, let you know the pricing. Loretta, should I receive info from my current supplement as to what the rate will be for 2021? If your rate's going to change, yeah, the carrier will send you the rate information between 30 and 60 days before the rate change. Okay, I mentioned this earlier, but with the supplements, you have that 6-month period where there's no medical questions when you first sign up for Medicare Part B. So that could be 65, it could be 68, 70, whenever you first sign up for Medicare Part B, that's when that 6-month timer starts. and you can get any Medigap or Medicare supplement you want during that 6-month period with no medical questions. After that 6-month period, that's where you have to go through the medical underwriting to enroll in the Medicare supplement. You may get a second open enrollment if you are on Medicare due to disability under age 65. When you turn 65, you'll get another open enrollment where there's no medical questions for a supplement. All right. All right, so that's kind of the intro section on kind of the different parts of Medicare, when you should sign up, what it's going to cost, what are the differences between supplements and advantage plans. The next section is the Part D prescription drug plans. And essentially, there's about 30 different drug plans to choose from. And we use a tool on Medicare's website called the Medicare Plan Finder to pick the best drug card for each individual. And you basically just enter in the drug information, the dosage, the frequency, and the preferred pharmacies. And the tool does all the work for you. And it basically figures out the total overall cost for the year based upon that specific list of medications for each of those 30 different drug plans. So, and then it sorts the list, and the one at the top of the list is the least overall expense for the year. And in most cases, that's the best drug plan for that particular individual for that year. All right. Each of those drug plans have to follow certain rules. And for the sake of time, I'm gonna skip go right into the demo for the Part D plan, so you can see how that Medicare Plan Finder tool works. So I'm just going to shift over to the browser here. Just give me a minute here. All right. So I'm assuming you can all see my browser now. And I'm going to show you how we pick the drug plan. You go to medicare.gov, and this tool, again, is going to be available to anyone. I will tell you, this is going to look a little bit slow. It's not this slow, but Zoom tends to slow down the browser window when you're sharing, presentation. So when you do this on your own, it should be faster. But if you want to do this, you go to Find 2021 Health and Drug Plans right on medicare.gov. And this is going to take you into the Medicare Plan Finder tool. And they changed this tool last year to basically completely upgrade it, if you will. But now you can log in to your mymedicare.gov account. So if you want to save your drug list, so each year you do this, you don't have to re-enter all your drugs. You have to create a mymedicare.gov account and log in to that account. For the purpose of this example, we're just going to continue without logging in, just to show you how the tool works. Your first question they ask is, what are you looking for? What are you looking for coverage for? For the purpose of this example, we're going to look at Part D drug plans. What is your zip code? We're just going to choose, we'll just choose 07016, our office address here. Do you get any extra help from Medicaid or other programs? No, I don't get any extra help. And then you hit next. Do you want to see drug costs when you compare plans? Yes, that's why we're doing this. Do you get your pharmacy or mail order prescriptions? We'll say both to look at the different drug costs, and you hit next. Now here's where you start to enter in the drug information. So for the purpose of this example, I'm just going to pick two pretty common medications, amlodipine for blood pressure. You hit add drug, and you can select the dosage. Let's say 2.5 milligrams once a day would be 30 per month. Add to my drug list. I'm going to add another drug. And the nice thing, when you start typing in the drug name, if you don't know how to spell something, actually I'll put in the brand name. So I'm on, let's say Crestor, which is a popular common cholesterol medication. You start typing in a few letters and it gives you the options. I'm going to select the Crestor. You hit add drug. Now this is a brand name drug. So I put in the brand name drug and the system prompts me, are you sure you don't take the generic? It's a lower cost version. Here's the name of the drug. You can add the generic or the brand name. Now I will tell you, almost every situation, if there's a generic available, the brand name is not covered by any of these Part D plans. There are exceptions, like Synthroid is one exception where there's a generic and a brand where the Synthroid is covered by most of these plans. But generally speaking, if there's a generic available, none of these plans are going to cover the brand name. So Crestor is one of those examples where none of the plans cover Crestor brand name. So for the purpose of this example, we're going to add the generic in. And again, you select the dosage. We'll say 5 milligrams, again, once a day. So it's 30 per month, add to my drug list. And for this example, I'm just going to do those two medications. I'm going to click done adding drugs. Now, the next thing you select are your pharmacies. Each of these Part D plans has a different pharmacy network. So you're going to get preferred pricing or standard pricing or no, out of network pharmacies. So we're going to select a few. We'll just take a couple of local pharmacies. You can select up to 5 options. And then we'll throw in like a Walgreens and a CVS just to see what they look like. And we'll leave in the mail order pricing as well. And then you click done. And now the tool is doing all the work for us. And it's figuring out that total cost for each of those 30 different drug plans, the drug cost plus the premium for the entire year. This is for 2021 I'm looking at. And basically it's going to sort the list. And the one at the top of the list is the least overall expense for 2021. So we're not just looking at premium. We're not just looking at drug costs. We're looking at the total to see which is going to be the most cost effective. Now for this individual, this plan, it's called SilverScript Smart RX, happened to come up to the top of the list. It happens to have the lowest premium, which is $7.30 a month. It does have a $445 deductible, but that's only for higher tier drugs. The number we're using to help pick the plan is this number right here, yearly drug and premium cost. So the tool figured out for us, if we go with this plan based upon our medications for the entire year 2021, our total cost is like $88. That includes a $7 premium plus the drug cost. And if you scroll through the list, you're going to see that number is going to keep increasing. So Clear Spring was the second one. It's $210. It has a higher premium, but also, there's a drug cost for those medications. And you keep scrolling, 267, 276, and you keep scrolling. These numbers keep going up, 400, so on. There's 3 pages of this, so it keeps going up and up. But basically, you can get a lot more detail once you click on the plan. So let's say that this is the one you're interested in because it seems to be the most cost effective. If you click on plan details, you'll see again the premium and the deductible for this, $730 a month, and then $445 is the deductible. It breaks down the cost for the different tiers of drugs. Each of these have like a 5-tier formulary. You can see it. Preferred generics have a 0 copay. Those are the tier 1 drugs, and then from there they go up. The copay or coinsurance you would pay for the medication. You also get the pharmacy information. So which of these is in, these 2, Walgreens and Barron's, are not in network for this plan. Bell's would be in network, but it's a standard pharmacy. CVS happens to be the preferred pharmacy for this plan. So that's going to have the lowest cost for those drugs if you go to the preferred pharmacy. And let's just scroll down. I'm going to go down to the CVS because these tables repeat for each pharmacy. But if you go to CVS, it's going to give us the pricing for each of those 2 drugs. They're very inexpensive drugs, but with this plan, it's a 0 copay, even before you reach that deductible, because these are lower cost drugs. If you've even met the deductible, it's still $0 copay. And so essentially, how do they come up with the $87.60? That's just the premium of $7.30 a month times 12, because these 2 drugs have a 0 copay. All right. And then it breaks down the drug cost by month, which again is just $0 because it's there's no cost for those 2 drugs at CVS. All right. So that's a very simple example, obviously a low cost example. If we add in a medication that's more expensive, let's see what that does to the model and the plans that come up as far as what's most cost effective. So it's a little slow here. We're going to go back and edit drugs and pharmacy. There's an eye drop that's pretty expensive. It's called Restasis. So we're going to add that into our model here. And basically there's these little containers. Most people use 2 of these a day. So you put them in each, the eyes. So it's 1 package of 60 per month. And you add to my drug list. And we're going to say done adding drugs. We're going to keep the same pharmacies. Now we're most likely going to see a different plan that rises to the top. It's for this expensive drug. We could see what shows up and what the total cost for the year would be by adding in that Restasis medication. All right, so now based upon that change, and this it just depends on the medication. Okay, so it doesn't mean if you pay more in premium, you're necessarily going to get a better drug plan. You could pay $100 a month in premium, and it might not even cover that expensive drug, where the $20 a month plan might cover. It's just very specific to the medication you're prescribed as far as which is going to be most cost effective. In this example, it's this Horizon Blue Saver, which is $23.50 a month with a $150 deductible. But again, the reason this one came to the top is because it has the lowest total cost for the year which is about $1,500 if you go to that pharmacy. If you scroll through these plans, you're going to see that number is going to be higher and higher. Clear Spring was $1,600. Cigna's having issues with their data right now, but SilverScripts, this was the one we were looking at before. So it'll be a little bit higher for the year. It'll be $1,680 instead of $1,530, you know, so not a terrible option, but you know, if you have that Restasis, it's a little more cost effective to go with that Horizon plan. You know, the bottom line is the numbers just keep going up and up. If we scroll to the last page, just to give you an idea of the impact, you know, if you pick the wrong plan and you have expensive medications, you know, the worst plan for this drug happens to be this Mutual of Omaha plan. It's $97 a month in premium, right? So you think you pay a lot in premium on getting a great plan. Well, your total cost for the year would be over $10,000 because that Restasis is not even covered on this plan. So that means you're paying the full cost of that medication for each month you're getting that medication if it's not covered. So I show you this so you understand, like, it's important. It's not just the premium you're looking at based upon your specific drugs, you know, what's going to be the most cost-effective plan. If we click on this Horizon plan, we're going to see the same level of detail again. It gives us the premium, the deductible, the different tiers. For each of the pharmacies, they're all in network, but they're all standard pharmacies. And then it breaks down the cost so you can see, you know, what are you going to pay for each of those medications before you meet the deductible, which is it's $150 deductible. You're basically going to pay the full, you know, $150. After the deductible, that Restasis would have a $45 copay. The amlodipine will be $0, and the rosuvastatin or the Crestor will be about $6. All right. So this, and then it breaks it down by month for you to show you, you know, because of that deductible, you got the $150 that first month plus the $50 copay there. And it shows you the cost just throughout the year as far as, you know, what it's going to cost each month in the model. And then the total, you know, the total for the year is at $1,500. So this is a very important tool. So when you first go on Medicare to pick the right drug plan, but then also every year during this time of year, this is the annual enrollment, October 15th to December 7th. This is the one time where you can change the drug plan for the following year. So I'm going to jump back to the slides here. We have a couple questions that came in. What if you never join Medicare Part D? Will there be penalties if you join after 65? So for the drug plan, if you don't have any other drug coverage, like you're not on an employer plan, there's a penalty of 1% for every month you don't have a drug plan when you're supposed to have it. So if you waited 3 years and then enrolled in a drug plan, it'd be a 36% penalty for the Part D premiums you pay the rest of your life. Again, if you have group health insurance with drug coverage, then you won't have that penalty. But if you don't, then you'll have to pay that. Can you change Part D coverage based on a change in medications? How often can you change? You can change a drug plan every year during annual enrollment, October 15th to December 7th, that for the following year. So it's kind of locked in for that year. Can you subscribe to 2 drug plans? That's Katie's question. Might it be cheaper to use one? No, you can only have one Part D plan at any given time. So now every Part D plan has to cover at least 2 drugs in each therapeutic category. So there's a high probability, even if you get prescribed a drug in the middle of the year, that it's going to be covered on any of those Part D plans. If for some reason it's not covered, you have a couple of options. One, you can go back to the doctor and see if one of those other 2 drugs would work. The other option is you could have the doctor file an exception with the Part D plan to see if you can get it approved just to get you through the end of the year until you can get on a new drug plan for the following year. Change from 2020. What's the purpose of the penalty for late enrollment? Yeah, the purpose of the penalty is it's something called adverse selection with insurance. If you wait until you get sick or need insurance to sign up for it, then essentially it's not insurance anymore, and the premiums would be ridiculous if everyone was able to do that. That's why they have those late enrollment penalties built in. All right, so I'm going to keep rolling here. I know we've got a few more questions there. We will get to those, but I want to get through the rest of these slides as well. Okay, 2020 Medicare changes. I'm going to quickly go through some things that happened in 2020. So this was kind of the very beginning of the year before the pandemic hit. Medicare is now covering acupuncture. So acupuncture used to never be covered under Medicare. It is now covered. So if you have Medicare and a supplement and you meet certain criteria, which you see on this slide, it has to be for chronic lower back pain. and some, lasting a certain period of time, et cetera. If you meet this criteria, you can get Medicare to pay for your acupuncture now and the supplement to pay, the other portion. So that's a nice benefit if that's something that works well for you. The Part D senior savings model. This was something that was announced in March, an executive order that basically is trying to reduce drug costs for people that have chronic conditions like diabetes, specifically with insulins, where they pay a lot of money for the insulin under Part D of Medicare. And what this model created is a flat copay of $35 or less for insulin type medications if you're on Part D of Medicare. So instead of having like a big deductible or paying more throughout the back half of the year due to the donut hole, which we didn't really get into just due to time, but this senior savings model will flatten that all out for people that are on insulin to just pay that $35 copay. And we project it'll save people, if they have insulin, about $500 a year for their insulin costs because of this, this senior savings model. So that's a good thing. Some things that were related, some things that changed this year due to COVID. One is just around out-of-pocket costs. Medicare is covering lab tests, serology or antibody tests, any hospitalization due to COVID. Medicare is covering. If there's a vaccine that becomes available, Medicare is going to be covering that. So essentially, they've just expanded, to make sure that these things are covered for COVID-related services. Telehealth has also grown. Telehealth is the ability to see your doctor through a virtual means, like a video call, where you can get prescriptions, and other things, advice, et cetera, from the doctor. That's covered by Medicare, but they've really expanded this year to include a lot of specialists that weren't previously covered. So now you can see a clinical psychologist, social worker, nurse practitioner, occupational therapist, et cetera, or physical therapist through telehealth, and get Medicare to pay for it. So that's gives you more flexibility. If you're not comfortable going to the doctor due to COVID or whatever, you can now get these services through telehealth and still get it paid for by Medicare in your supplement or Advantage. The other changes that were around COVID were really about flexibilities with enrollment and trying to make things easier. If people were impacted by COVID, they missed an enrollment window, then there's special enrollments for those folks if due to COVID, and more leniency with prior authorizations and other requirements if you were impacted by COVID. So those are some other changes that were made this year due to COVID with Medicare. All right, I just want to quickly review these top 5 mistakes people make on Medicare, and then we'll get to the remaining questions. The first biggest mistake we see people make is not enrolling in Medicare Part B on time. So again, you have that 7-month initial enrollment period around your 65th birthday. If you don't have other credible coverage through like an employer plan, that's the time you have to enroll to avoid those penalties and delays in your Medicare coverage. We talked about the COBRA situation. If you're past the age of 65 and you're leaving group coverage, COBRA generally doesn't make sense, but if you want the COBRA coverage, you have to get the Part A and B of Medicare, because that's going to become your primary coverage, because you're Medicare eligible. The second biggest mistake people make on Medicare is not analyzing their prescription drug costs. This could cost you thousands of dollars. We just looked at that example where picking the worst plan versus the best plan was like $8,000 a year difference in cost. We use a tool on Medicare's website. It's called the Medicare Plan Finder. It's available to anyone. You can do that on your own. There's about 30 different drug plans to choose from, and you really want to, just paying more in premium doesn't necessarily mean it's a better drug plan. It's just kind of specific to your medications. And again, you get an opportunity each year, October 15th to December 7th, to review the drug plan for the following year. The third biggest mistake we see people make is not understanding the difference between Medicare Advantage and Medigap or Medicare supplements. These are two very different types of coverage. Again, the Medicare Advantage is the fully privatized option where the insurance company takes over and fully manages your benefits for you. Those are generally HMO type plans. Some of them now have an out-of-network or PPO option, where the Medigap plan is just supplementing Medicare. And you can go to any doctor or hospital in the country that takes Medicare. The premiums are generally lower on those Advantage plans. Remember, you can get a 0 premium Medicare Advantage plan. You're not going to get a 0 premium Medigap plan. The out-of-pocket cost is also very different with the Advantage plans. It's up to $7,500 per year in out-of-pocket cost. With the Medigap plans, it's generally anywhere from $0 to a couple $100 in out-of-pocket exposure. The other thing, extra benefits. So some of those Advantage plans can offer extra benefits, and most of the commercials you're seeing right now, most of the flyers you're getting in the mailbox, if they're advertising things like dental or vision included with the plan, things like transportation, some of them offer Uber or Lyft rides. Those are Medicare Advantage plans where they're bundling in those extra benefits into the Medicare Advantage plan. With the Medicare supplement, they can't do that. They're not allowed to add those extra benefits like they can with the Advantage plan. So most of those commercials, if you see the Joe Namath commercial, that's a Medicare Advantage plan that he's discussing on that commercial. But that's the third biggest mistake we see people make. The fourth biggest mistake is not analyzing your retiree health plan. So there are cases where people have retiree health benefits that are very good. Maybe they pay zero premium and they should stay on that retiree health plan. But there's other cases where people have a retiree health benefit and they're paying $300, $400 a month for that benefit when they may be better off getting their own supplement and drug plan, on their own. And the fifth biggest mistake we see people make is listening to their friends and family. And we joke about this, but it happens all the time. My spouse, my cousin, my neighbor, has such and such plan, and that's what I want. And well, let's talk about your situation, because Medicare is an individual policy. There's no more family plan or even husband and wife coverage. So you really want to pick the right coverage for your particular situation. The drug plans, especially if you have, a certain list of medications, you want to pick the best drug plan for your particular situation. So I know I rushed through a little bit towards the end there. I just wanted to get through those top 5 mistakes, and we still have some questions I want to get to that are in the Q&A window. And then I'll do a quick recap and hand it back to Cindy as well. So Elizabeth asked, can a provider charge Part B excess charges if you are Medicare and Medicaid? So generally, if you're Medicaid, and you're going to a Medicaid provider, there wouldn't be an excess charge that would be charged. They'd have to charge Medicaid, whatever that service is. You really shouldn't have any out of pocket if you're going to the Medicaid participating provider. Anonymous, so you could use this tool and determine which is most cost effective and then sign on from the site, and it would change it from your 2020 plan to the new plan for the next year. That is correct. So that's the Medicare Plan Finder tool we showed. You can look for different options. You can actually enroll directly there as well into that drug plan for the following year. And if you enroll in a new drug plan, it automatically cancels your prior drug plan for the prior year. Katie asks, I have seen an ad for discounts like GoodRx. Would these apply to Medicare as well? So GoodRx is a third-party website, and there are situations where it's a good resource to check for drug costs, where there's certain drugs that just no Part D plan covers, or the costs are just higher on Part D than they are on a GoodRx coupon. So that is a good secondary resource. It's not, does not replace Part D of Medicare, so you still need to have Part D to avoid those penalties and have coverage for like expensive drugs. But like, for example, like Cialis type medications are not covered by any Part D plan, but you can get a coupon on GoodRx for, I think, $15 a month or something, for that type of medication. So there are examples where that would be beneficial. Anonymous attendee, are drugs to treat cancer part of Plan D or Part B? So cancer medications generally are covered by Part B. So chemo medications are generally covered by Part B, as in boy. Not always the case, but generally Medicare pays the 80%, and then the supplement pay the other 20%. Anything administered in a doctor's office or outpatient facility would definitely be covered by B versus D. But the other medications, well, a lot of them are covered by Part B, as in boy. Lucille, this is not a political question. If the payroll tax were reduced, how would this affect Medicare, if at all? So, I mean, just purely from a fiscal perspective, if you read the Medicare Trustees Report, which is a nonpartisan report, and it comes out every year around June, the latest expectation for Medicare Part A hospital fund to run out of money or not be able to support the expenses is 2026, which is only a few years away. So any reduction in additional funds into Medicare would just reduce that, even further as far as when that would run out of money. So that's just purely a fiscal response to that question, Lucille. Turning 65 in August 2021, initial enrollment in Medicare and supplemental to be effective August 1st. Can I schedule elective surgery for joint replacement in September, or is there a waiting period? So no, if you're enrolling initially in Medicare as part of your initial enrollment period, and you're enrolling a supplement, for the first of that month, that you'll be covered, day one. There are certain carriers with the supplements that do have a waiting period if you don't currently have any health insurance and you're going into that supplement. So we would avoid those carriers, for that particular reason. So there wouldn't, be a waiting period. But again, that only applies if you don't have other coverage before you go on Medicare. Elizabeth asks, if provider accepts Medicare but not Medicaid, can provider charge the excess charge? Yeah, essentially they could. If they are Medicare participating provider does not accept Medicare assignment, they charge that excess charge. And it's not very common that they would do that, but and if they elect to do that, it's over a 2-year period. Every patient they see for every procedure would get that excess charge. And you could ask them ahead of time whether or not they accept assignment or if they charge the excess charge. All right. All right. So the Q&A window is cleared for the moment. So I'm going to quickly recap. I mentioned this during the presentation, but we're not a fee-based service. So if you want to work with us, we'd love to work with you. There's no fee to work with us. We kind of help guide people through the process when they're first going on Medicare, kind of walk them through the steps, let them know the different options that are out there, the different prices. We look for the best rates for each of the carriers that are out there, and we help them with the drug plan, et cetera. And again, there's no fee to work with us. You pay the same premium, whether you go directly to the insurance company or if you use a broker like us at Senior Advisors. And like I said, we'd love to work with you, whether you're going on Medicare, you just want a comparison with your group plan versus Medicare, you're already on Medicare and you want to make sure you've got the most cost-effective options. We can help with all those different situations and help guide you through the process. So I hope you found this informative and helpful. And one last question, can Plan D providers change prices in their formularies during the year? Yes, the drug plans can change. It's not very common, but they can change tiers and pricing of the drugs. The pharmaceutical companies change the drug pricing, periodically throughout the year as well. Generally, they're not massive fluctuations in price, but they do change throughout the year. So I think that's it for our questions. So thank you again all for joining. Again, I hope you found this helpful. We'll get the recording out as well. So if you're interested in watching this again or passing it along to your friends, we'd appreciate that as well. And hope to work with you in the future. Thank you. I'm going to give it back to Cindy. Let me unmute you. If you're still there, Cindy, I asked to unmute. I don't know if you're there. You are. Oh, you got to unmute.
Thank you.
All right.
Thank you so much, Justin. Thank you all for joining us today. I hope you all found this information very informative. It's extremely complicated. I can tell you I've been working with Justin for the last 3 years. I have sent many of our donors or benefactors of the hospital to Justin and many personal friends, and he has helped all of them, again, in this very complicated arena of insurance. So Justin can be reached right here. Here his contact information at those numbers and emails. We hope you will continue to support Morristown Medical Center and all of our Atlantic Health hospitals so that we may continue to deliver safe and honest medical care in the world. Stay well, and if you need us for anything, please contact me at any time for testing, for rapid testing, for anything related to recommendations or referrals at our hospitals. Thank you so much.
Take care.